Good afternoon. Welcome to the Thurston County Board of Health meeting for this Tuesday, May 10th, 2022. It's 3:32 p.m. My name is Ty Menser, Chair of the Board of Health. To my left is the Vice Chair, Commissioner Gary Edwards, and to my right is Commissioner and Board Member Carolina Mejia. County Manager Mira Chavez is to her right. Our Clerk of the Board, Jamie Caldwell. Okay, very, very good. And we have Kurt Harden on Zoom, who is our Interim Director of Public Health and Social Services, and our County Health Officer, Dr. Dimiana Abdulmalik. So with that, we will call this meeting to order, and I am looking for a motion regarding the proposed agenda.
Ready?
Yep.
I would make a motion to approve the agenda for today's meeting, Tuesday, May 10th, 2022. And very often you tell me I'm not talking loud enough.
There you go. Can you restate that motion?
Mr. Chair,
Yes, sir.
I would like to move to approve the agenda of today, Tuesday, May 10th, 2022.
I'll second.
Motion has been made and seconded to approve the agenda, proposed agenda for May 10th. Any further discussion on regarding the motion?
No, sir.
No, sir.
Call for the vote.
Commissioner Edwards?
Aye.
Commissioner Mejia?
Aye.
Commissioner Menser?
Aye. Motion carries. Agenda is approved. We have board meeting minutes from April 12th, 2022. Is there a motion?
I would move to approve the meeting minutes from April 12th, 2022.
Second.
Motion has been made and seconded to approve board meeting minutes from April 12th. Any further discussion?
No, sir.
Call for the vote.
Commissioner Edwards?
Aye.
Commissioner Mejia?
Aye.
Commissioner Menser?
Aye. Motion carries. Board meeting minutes are approved. Next is proclamations and presentations. First is Proclamation for Mental Health Awareness Month. I'm going to pass the baton to Kurt Harden, our interim public health director, to introduce this and any guests we might have.
Okay, thank you, Commissioner. Kurt Harden, Interim Director for Public Health and Social Services. I'd like to have Gretchen Thaler go ahead and present this topic, and I know she has a real passion for this as a lot of people do, and let her introduce our guests that will be speaking as well.
Thank you, Kurt. Hi, my name is Gretchen Thaler with Public Health and Social Services, Maternal Child Health Division Director. Good afternoon, Commissioners. Thank you for the proclamation recognizing mental health awareness. Mental health concerns can affect any one of us and have had a profound impact on our health and well-being. We must care for our mental health for all ages, from our young children to our elderly. We know that the last 2 years has been especially challenging for many, including our youth. According to the 2021 Healthy Youth Survey, 37% of our 8th graders reported signs of depression and 41% of our 10th graders. These rates are both higher than the state average. And following that same path, we've had 21% of our 8th graders and 22% of Thurston County 10th graders that have contemplated suicide in the past year, again, higher than the state average. One of the biggest challenges in our community that we hear in maternal child health is the lack of resources for mental health services. We know that all of our services have been overwhelmed in the last 2 years with the pandemic. Public health has the opportunity to work with our community partners to help promote access to care and other ways to support mental health. It takes all of us working together to impact this growing concern. With that, I'd like to pass it over to one of my PHSS partners, Carrie Hennon.
Good afternoon, Commissioners. Carrie Hennon. As you know, I manage our treatment sales tax here in Thurston County, and treatment sales tax is local funding for mental health and substance use disorder treatment and related support services. So glad we're talking about mental health today. As Gretchen outlined, we see really high levels of need in our community right now. And in my role, I'm lucky enough to work with a lot of people who are working to address those needs in a lot of different ways, including Gretchen, who you heard from, and the next two people you will hear from. So I wanted to start by introducing Mark Friedman, who's the Chief Executive Officer of Thurston Mason Behavioral Health Administrative Services Organization. Thanks for being here, Mark.
Oh, my pleasure. Thank you for inviting me. And thank you, commissioners, for support of the ASO. We have been working through many challenges in the community, but we have developed considerable programming and advancements in serving, particularly acute care for the community wide, working closely with providers, service providers, the hospitals, the evaluation treatment facilities, law enforcement, and local police, as well as jail and prosecuting attorney and defense. We have developed considerably over the past couple of years. Appreciate the support in being able to, what we feel has to administer a proactive program, helping to do things like diminish use of the jail for the mentally ill and try to support people in their efforts at recovery to become viable individuals in the community. So thank you for support of this proclamation.
Thanks, Mark. And then I'd also like to introduce Marilyn Roberts. Marilyn, I get to work with Marilyn because she is a member of the Treatment Sales Tax Advisory Committee, but she spends many, many, many other hours of her day, 26 hours of every day, I think, she spends advocating on behalf of people suffering from mental health challenges and their families and supporting families as part of her work at NAMI Thurston Mason. So thank you for being here, Marilyn.
Thanks for that kind introduction, Carrie. Good afternoon, commissioners. Again, my name is Marilyn Roberts, and I'm the Director of Operations for NAMI Thurston Mason. And I might even talk longer than Mark here for a minute. This could be a first. A little bit about.
Given a limit.
Oh, okay. For those of you that don't know about NAMI, it stands for the National Alliance on Mental Illness, and it is the nation's largest grassroots mental health organization dedicated to building better lives for millions of Americans affected by mental illness. What started as a small group of families, where all great things start, around a kitchen table in 1979 has blossomed into the nation's leading voice on mental health. Today, we are an alliance of more than 650 affiliates nationally, 49 state organizations, 19 affiliates within the state of Washington. And we are here to raise awareness, provide support and education for anyone in the community. Our mission is really simple. NAMI provides advocacy, education, support, and public awareness so that all individuals and families affected by mental illness can live better lives. Mental Health Awareness Month has been observed in this country since 1949, a long time ago. Each year, millions of Americans face the reality of living with a mental illness. During May, NAMI joins the national movement to raise awareness about mental health. Each year, we fight stigma, provide support, educate the public, and advocate for policies that support people with mental health challenges and their families. Mental Health Awareness Month provides an opportunity for the NAMI Alliance to shine in spreading that word around resources, local programming, and even specific programs that cover caregivers, youth, young adults, and unrepresented community members. We encourage people to take action through efforts such as voting for mental health care and also improving our nation's crisis response system. So that being said, our 2022 campaign is Together for Mental Health. And I think that's where we're all at right now, is together, because it has been an incredibly challenging couple of years. And with this message, we're encouraging people to join together to advocate better for those that we care about. Thank you for your time.
Thank you, Marilyn. Carrie, is that the roundup?
Yes, thank you, Commissioner.
Okay, very good. Commissioner Mejia, anything you'd like to say?
No, I'm just really happy that we're doing this. it wasn't that many years ago where mental health was not really something you talked about. It was seen as a taboo. And as we're seeing newer generations be more open about mental health awareness, I think it's just really important that we follow suit in this. So really happy that we're doing this. I think we have to talk about it more. We have to keep providing those services that are so essential. So thank you all for being here today.
Commissioner Edwards?
No, I think I'm just ready to read this proclamation. I'm glad we're doing this. I know there's a lot of folks out there struggling.
Yes, we get a lot of proposals for proclamations. I was excited that we were able to accommodate this one. This is my 4th year as a board member on the Thurston Mason Behavioral Health Administrative Services Organization with Mark, and I've learned a lot about this area in my time as commissioner. What Commissioner Mejia said, and Marilyn's right on target. I've learned a lot about reducing stigma and raising awareness being really, really important. We had a speaker recently at WASAC. I think my seatmates were probably there as well. And something that was said just kind of stuck with me, that mental health is health, is what they said. And when they first said that, I was like, what are they talking about? But she was like, gives example. If someone in your family has diabetes, you know what that is. It's diagnosed, it's treated, everyone in the family knows how to respond to it. It becomes no big deal. Mental health is just not seen that way because of historical stigma and people not being used to talking about it, but it's an essential component of health. So the closer we get to that, the more we are able to make it something that can be managed appropriately and healthfully for the folks that are suffering from those issues. So this is good, and with that, Mr. Vice Chair, ready for the proclamation.
Okay. Thurston County Proclamation, Mental Health Awareness Month of 2022. Whereas mental health is an essential part of overall health, and whereas 1 in 5 American adults experience a mental health problem in any given year, and less than half of them receive treatment, and whereas 1 in 6 U.S. youth experience a mental health condition each year, and only half of them receive treatment. And whereas 1 in 10 young people under age 18 experience a mental health condition following a COVID-19 diagnosis, and whereas 50% of all lifetime mental illness begins by age 14, and 75% by age 24. Yet the average delay between onset of mental illness symptoms and treatment is 11 years. Whereas mental health conditions can affect a person at any point in their life, but adolescents, military veterans, and LGBTQ individuals experience mental health conditions at rates higher than the general population. And whereas suicide is the second leading cause of death of people ages 10 to 34, and the 10th leading cause of death in the United States, and 90% of people who die by suicide experienced a mental health condition. Whereas people with depression have a 40% higher risk of developing cardiovascular and metabolic diseases than the general population, people with serious mental illness are nearly twice as likely to develop these conditions. And whereas it's important to measure how common mental illness is so we can understand its physical, social, and financial impact and show that no one is alone. And whereas Thurston County and key partners such as community-based behavioral health agencies, the Thurston Mason Behavioral Health Administrative Services Organization, and the National Alliance for Mental Illness work to ensure access to high-quality treatment and support for children and adults in need of mental health services throughout Thurston County. And whereas every individual and community can make a difference in helping end the silence and the stigma that for too long has surrounded mental illness and discouraged people from getting help. Now, therefore, be it resolved, the Board of Health hereby proclaims May 2022 as Mental Health Awareness Month in Thurston County to increase public understanding of the importance of mental health and to promote identification and treatment of mental illness and substance use disorders. Adopted this 10th day of May 2022, your Board of Health.
Okay, thank you. Thank you to our guests, Marilyn. Thank you, Mark and Carrie. The board would also like to add an additional recognition. Earlier this year, we had a Public Health Appreciation Week, but there is actually a Nurses Week this week, at least sometime this month. I think it's this week. And in honor of Nurses Week, we would like to thank the nurses in our community that have worked tirelessly throughout the pandemic. Nurses make a difference through many different roles throughout Thurston County, to include school nursing, volunteer-free clinics, our hospitals, our long-term care facilities, home health, as well as our public health nurses. Every day, nurses bring passion, advocacy, knowledge, and dedication to the care they provide. We at the Thurston County Board of Health recognize the incredible sacrifice you make to keep us all safe. We'd like to thank you and add this additional recognition to earlier thanks we gave during Public Health Appreciation Week. So I'm going to clap for that. Okay, next is under, I guess, the category of presentations. This is fentanyl impact in Thurston County, something we've talked about digging into for a couple of months. We wanted to make sure we had the different aspects covered, and I think staff's put together that presentation. So I'm going to, let's see, Katie Strozik, our opioid response coordinator. I'm going to pass this baton to you and let you kind of lead the show here.
Thank you, Commissioners. Katie Strozik, I'm the Opioid Response Coordinator at Public Health and Social Services. So we have kind of a multi-tiered presentation for you today. Like Commissioner Menzer said, we wanted to cover a couple different aspects relating to fentanyl. So I'm going to go ahead and kick us off. We have kind of fentanyl basics and then tying it over to our Thurston County Opioid Response Plan. From there, we'll turn it over to Ben Miller-Todd from Emergency Services and Medic One. He'll be going over what EMS is seeing in Thurston County and some overdose data. And then from there, we'll be turning it over to Sheriff Snaza, who I believe is there in person, and he'll be talking about the law enforcement perspective and law enforcement response for Thurston County.
We also have Prosecutor Thunheim as well. Is he part of this?
Yes, I didn't know if he was able to make it or not. So if he's there in person, I can't.
Just wanted you to know he made it, so he's here.
Perfect. So then after Sheriff Snaza, we'll turn it over to Prosecutor Thunheim. Thank you for that. I can't see the people on my side of the screen.
Yeah, absolutely.
And then I wanted to mention too that today's presentation is especially timely. Today is actually the first ever National Fentanyl Awareness Day. So it's kind of great that this coincides on May 10th of National Fentanyl Awareness Day. All right, so I wanted to kick us off with some basics so that we all have kind of the same starting understanding of what opioids are and especially what fentanyl is. So opioids are going to be a class of drugs which attach to opioid receptors in the brain, and they provide a variety of effects. So this could be something like pain management. It could be something like a euphoria or a high feeling, depending on what someone is consuming, how they're consuming it, and the dosage that they're consuming. Opioids come in both prescription and unregulated or illicit forms, and we have some examples listed on the other side of the screen with both the generic names and the brand names listed. So we have everything from our Vicodin or our Oxycontin to things that we know as more illicit or street drugs such as heroin and fentanyl. These can come in all kinds of varieties. So you can talk about pills, it may be powders, it may be other substances as well. So fentanyl is going to be a synthetic opioid, and the reason why it's so concerning is due to its potency. Fentanyl is going to be 50 to 100 times stronger than morphine. Originally, back in the day when we talked about fentanyl, we talked about prescription or pharmaceutical grade fentanyl that was developed in order to manage pain in cancer patients. That's no longer the fentanyl that we're dealing with today. The fentanyl that we're seeing today is made in labs that is not regulated by pharmaceutical standards and made outside of regulations. Fentanyl can be used on its own or mixed in with other substances. That mix in can happen unknowingly for folks as well. So someone may be choosing to use fentanyl as their drug of choice, or fentanyl is the primary drug that they're choosing, or they may be using something like heroin that has fentanyl mixed in as an additive. Fentanyl also can be consumed in different ways. So as we talked about, it comes in different forms. You can use fentanyl through pills, you can use fentanyl through powders, smoking, or injecting as well. One of the main concerns that comes along with fentanyl is the very high risk of overdose. So for opioid-related overdoses, those are going to occur when opioid use exceeds an individual's tolerance. That's going to depend on the individual. So each person is going to have a different tolerance depending on how often they use opioids, what opioids they use, things like that. Once tolerance is exceeded, the individual will go into respiratory depression. That's when their breathing is going to slow down and ultimately stop. From there, their heart will stop, and then that's when it becomes a fatal overdose. Naloxone, or also known by the brand name of Narcan, can be used to respond to an in-progress opioid overdose. So that's any time in between when the person loses consciousness and when time of death is called and it becomes fatal. Fentanyl poses an increased risk of overdose because of its potency and how much stronger it is from other opioids, and the fact that someone may be using it unknowingly, especially if it's mixed in another substance that they're using. So we frequently hear about when someone is consuming what they may think is heroin and it has fentanyl mixed in it, they don't know, and so their risk of overdose is higher. There's a lot of fentanyl specific concerns, but we tried to pull out some of the top 3 that we hear the most in the community and then the media. One is that there's concern that fentanyl can cause an overdose just by touching the skin or just by touching fentanyl. That is false. It's not absorbed well through the skin. So the fear and kind of the misinformation that just by coming into contact with fentanyl you can overdose is incorrect. There is also concern that it may require additional doses of naloxone to intervene during an overdose. The main concern with this is that folks don't always have enough naloxone available to respond. Before, when we were talking about heroin overdoses back in the day, it may take 1 or 2 doses of naloxone to intervene during an overdose. But now when we're seeing more fentanyl specific overdoses, we're seeing folks administer 5, 6, 7 doses of naloxone, and sometimes running out of naloxone before EMS can arrive. The biggest concern is that fentanyl is lethal in very small amounts, and then it can be hard to detect when mixed in with other substances. It takes a very, very, very small amount of fentanyl to cause a fatal overdose, which isn't visible to the eye. So you may have what you think is one substance. It could have fentanyl in it, and it could be deadly. So tying this back to the Thurston County Opioid Response Plan, that was developed as a result of the crisis being declared by the Board of Health back in June 2018. You can see up on the screen, there are 5 strategies in our response plan that specifically relate to overdose. This includes everything from increasing information within the community to providing naloxone, to providing education about how to intervene with naloxone and how to respond to an overdose, how to access naloxone at pharmacies, and then also increasing available education on stimulant overdoses and overamping. And then kind of a graphic here that'll pair us into Ben's data here. You can see that when we looked back at 2020, our fentanyl-related overdoses were fairly low and that they have increased over time as we're seeing more fentanyl in our drug supply and as folks are shifting into having fentanyl as their main drug of choice. So from here, I will turn it over to Ben Miller-Todd to share some information about fentanyl and opioid-related overdoses and what EMS is seeing.
Perfect. Thank you, Katie. Good afternoon, commissioners. I wanted to, as I go through this, please feel free to jump in and ask any questions. Katie did a wonderful job of giving an overview over fentanyl and opioids and Narcan and all those aspects to inform the conversation moving forward. I did want to present just a little bit of data from the EMS side to help inform the conversation just a little bit more. I'll preface the data that it is EMS data. And so it's very important that you understand that the data that I present may not have diagnoses specific to their ultimate cause that we can capture. EMS is basically designed to synthesize all the signs and symptoms that they see in a patient, put that together with their vitals, and come up with what we call a differential diagnosis, or a list of potential causes for the ailments that are being basically presented to them by the patient. They're able to treat based on protocols, and those protocols are based around how those patients present to them. In terms of opioids, they can present in a myriad of different fashions, obviously with respiratory depression, altered mental status, decreased level of consciousness, but I want you to be aware of some of the limitations of the data as we present this. I also do want to call out that Corey Spots, one of our Lacey Fire District 3 paramedics, did a wonderful job of diving into the data and did some manual abstraction on a lot of charts, and exactly 302 charts as we bring this up, and it should have been included in your packet, of the ALS or paramedic level responses for Narcan deployment in Thurston County for 2021. As you go through that pamphlet, and I'll bring it up here in just a second, please keep in mind that when there are pieces on this data set that say suspected or confirmed or unknown, that plays into the fact that this is EMS data, not hospital data, and they don't have the same diagnostic capabilities in the field as they do in the hospital. And so keep that in mind as you're reading through some of this data, some of those limitations. I'm going to pull up the presentation quickly just to walk you through some of those data points. And let me know if I need to expand the screen at all to walk you through this. As I indicated, this is 302 incidents that occurred throughout the course of 2021. Corey was able to divide those up into either the patient confirmed or bystanders confirmed, or Narcan positively worked on the patient's end outcome as a confirmed, suspected or as defined in front of you, and then unknown were an unknown decreased level of consciousness or altered mental status. In 2021, we responded to 58% of the total responses were confirmed deployments of Narcan, were confirmed opiate overdoses. Suspected were roughly 25% of that, and unknown were 20%. I'm going to drop down here. The end disposition for these patients, as you can see here, there's a number of different ways that the patient disposition or the end result after EMS occurred. The vast majority of those were 66% were transported by that paramedic unit into a local hospital. Since ALS is deploying the Narcan in these scenarios, we expected that. But still, unfortunately, with ALS responses, there may still be an instance where we deploy Narcan and the patient completely refuses any transport or treatment and proceeds to leave the scene. Those are classified in two different categories here, either left on scene without a signature that they just departed the scene, or it was against medical advice, that the paramedics or EMTs tried to talk them into going to the hospital. They refused care and continued to leave the scene. And unfortunately, about 11% of these Narcan deployments in the county still resulted in an end disposition of death, and we'll talk about that here in just a second. In 65% of our charts throughout the county, we did have a patient improvement after Narcan deployment. And I did want to give you a little bit of an idea on where exactly we're seeing the most number of deployments of of Narcan throughout Thurston County. Far and away, Lacey Fire District 3 gives the most Narcan, had the most contacts. What I will point out here is that there's a little bit of a deployment model issue involved with this. One of our medics that is managed by Lacey Fire District 3 sits just about on the border between Olympia and Lacey. And so they respond into the city of Olympia quite frequently. And so this threw off the numbers just slightly in terms of where you might expect some of those deployments to occur. So just keep in mind, this is based on where the medic units are coming from, not necessarily the political delineation of those cities or those districts. Narcan, in our charting system, we're able to, and as you're looking at the public Narcan deployment, these are the deployments that we were able to capture when we were on scene. This is not the total number of bystander deployments of Narcan or law enforcement deployments of Narcan in the county. So please be clear on that. This is what we were able to capture within our charting system. 29 times Narcan was applied to the patient or administered to the patient, excuse me, prior to ALS arrival, and law enforcement administered in our charts 13 times prior to EMS arrival. I'm going to slide down to the last set here and the piece that I really wanted to emphasize. Unfortunately, in 2021, we saw a 40% increase, and I'm sorry, I will resize this here shortly. We saw a 40% increase in overdose-related cardiac arrests, mainly associated with opioid overdoses. This is something that was in stark contrast to past years, and we also saw a 29% jump in the overall number of cardiac arrests we were seeing in Thurston County. As we were teasing out some of those pieces, Corey reached out to Katie and her team just to present some of this data, and so this conversation kind of spiraled as to what we're seeing. One thing that we did want to message, and I want to leave you as commissioners with for the Board of Health, is that we really want to see earlier activation of the EMS system in Thurston County, or activation of 911. As we're going through this process, a lot of medical aid can be administered or can be talked through the dispatchers, as well as early activation of EMS, fire, paramedics, and getting these patients to the hospital. One thing that I want to point out, that there's a very, very clear increase in survival related to any form of cardiac arrest with earlier activation of EMS and earlier arrival on scene from point of need. And so that's something I wanted to impress to the commissioners as we walk through this process, that earlier activation and messaging of that in terms of 911 may help to increase patient outcomes in these scenarios. With that, I will turn it over to Sheriff Snaza.
Okay, first off, I want to say thank you for allowing us to talk a little bit about this. Just to give you a quick heads up, I'm actually the past chairman of the High Intensity Drug Trafficking Area Board. It's the HIDA board. There's 29 HIDAs in the United States, and we have one here in the Northwest. When we talk about fentanyl, go ahead. And yes, we do have a fentanyl problem, and they've already explained it pretty good. So I just want to talk about how we get fentanyl. And obviously you can see here, it's through the web. You can get it through a lot of different ways. And I'm just looking around here. And as you can see, a lot of the dark websites are the encrypted websites that people get it from. And I think in the next slide, it's going to show you that most of the fentanyl that we're seeing, go ahead, is coming from the Mexican cartels, which we are seeing most of all of our fentanyl coming from is Mexico. And also, when we say existing clients and existing drug routes, mostly it's coming up through Mexico. And what we're seeing is that coming up into Washington State, and then we're seeing it kind of go over to what we are seeing in the drug task force is it going up through, go ahead and do the next slide, is through Yakima, and then it's coming down this way. And the reason is because we're the main I-5 corridor, but we're also the 101 corridor. And so we're getting it out, or they are getting it out to the coast. And that's where we're seeing a big distribution hub is here in the Olympia area. And as you can see, how it's being paid for is usually by Bitcoin. And then you're looking at how it's shipped. And there is no detection really on a basis for detecting how fentanyl is being shipped, unless we get some really strong intel about where it is coming from and who we believe it's coming from. And that's through our drug investigations. Go ahead. So the way we're getting most all this is through obviously our Thurston County Narcotics Task Force. It's a multi-jurisdictional drug task force. Right now, the units that are assigned to the Narcotics Task Force is the Thurston County Sheriff's Office and Washington State Patrol. We do have some federal agents. We have Homeland Security, we have Drug Enforcement, we have the FBI, we have ATF. We do use Department of Corrections at times, as well as the U.S. Marshals. And the reason why I really believe that we are seeing a larger resurgence of not only just drugs in general, but more of the fentanyl is we dealing with the Blake decision that allows for drug use, and agencies that are not involved in being associated with taking down drug task organizations, ZTOs. So we're seeing that it's only Thurston County right now in the State Patrol, and we're working with other agencies, with our local law enforcement agencies to get back on board, as they used to be about probably 7-8 years ago. So the primary mission is to investigate and arrest mid to upper level drug trafficking persons or organizations, and then refer them obviously to the prosecutor's office or through the federal prosecution way. Go ahead. Go ahead and go through a little bit more. So the 2021 task, I think Ben did a pretty good job of doing it. It is a priority on us as far as fentanyl because of what we're seeing it get into. So I know we're talking a lot about fentanyl getting involved in with the opiates, but what we're seeing now is fentanyl is also being added to our cannabis and also to our methamphetamine. So we're not just seeing fentanyl and opiates anymore. And we've done 25 cases, 14 of them arrested, 14 arrests. And this one particular case was 167,000 pills. And what they do is they use pill presses that are from the DEA. They all have DEA numbers. It's just finding out where they got the pill press. Is how we were able to track down where the fake pills are coming from. But what we are seeing, is what we're noticing, is that our youth tend to, when they say that, like a 15-year-old or something is saying, I have my back hurts, so I want to take an oxycodone. And what they're doing is they're going to a friend who got it from a friend and doesn't know that that's not a real oxycodone and it actually has fentanyl in it. And so they believe they're taking a actual prescription drug when in fact they really aren't. So that's what we're seeing with that. Go ahead. When we talk about combating anything, whether it be crime or the drug epidemic that we're seeing, obviously more staffing for our narcotics task force, and we need more federal funding that is going to absolutely reduce what we're seeing. But right now, there's a lot of things going on in our state, a lot of law changes that are affecting all of us. And unfortunately, what we are seeing within the law enforcement community is that the fentanyl is really affecting our youth. We're seeing 18, they say the average user is 18 to 44. But what we're seeing is in our youth, it's 18 to 24 is our main users of fentanyl and opiates. Go ahead. Go ahead a little bit more. So what we are seeing is that how are we getting this information? And as you can see, the way people look at fentanyl, and you go to one incident where a male and a female are at an incident, they each take the same pill. The male it does not recover from the use of the pill. And the female says, oh, I didn't use any of that or anything. Well, then 8 hours later, we're back at her house because she's actually using the same type of pills that she just saw her boyfriend die from, and now she did it. I mean, and they're saying that I have a tolerance for it, so I'm not going to be affected like that individual. And what we're seeing is that fentanyl doesn't, when it is added to an opiate, or when I say an opiate, like a pill, oxycodone or Percocet, or with actually brown tower heroin or methamphetamine or even marijuana, it's just little sprinkles. It's like little pieces of salt that is put on that product and it's dabbed in there. And so there isn't a particular amount. No one goes like, you get one, and it's just little dabs of fentanyl that is put on the product. So you don't really know the exact amount of fentanyl you're getting, and what it is mostly people are out there for the thrill of the feel of what that opiate does to them. And in the end, like it says right there, it doesn't matter when I get sick. You want to go for a lot longer time. And that's what we're really seeing. Go ahead. Obviously, the market is driven by the desire, the want. And right now, fentanyl is on the highest demand. As a matter of fact, and I know Ben probably didn't know this, but Thurston County is tied for number 2 in the state of Washington for fentanyl deaths in 2021. And we're tied with like Skamania County, which is down at the bottom, down by the river, crossing into Washington State. And the number 1 is, Yakima. And so what we're seeing is it's here to stay for a while. And what we're trying to do is obviously eradicate as much as we can. And as it was mentioned earlier, we are using Narcan or naloxone to combat when someone is affected by it. And what we have been seeing is that even in our jails and our prisons, it's getting in there as well. And as you recall, as board, you were briefed about a month and a half ago where we had 4 individuals were affected. Someone was able to smuggle some fentanyl in, and 4 people overdosed on that. And the only reason why they're alive today is because of Narcan and because of the quick response of the deputies and the medical staff themselves. So we are seeing it get into every aspect of all our lives. Go ahead. So suggested solutions. We're seeing, and I know that with Mark, and when we're talking about, earlier we were just talking about mental illness. And what we're seeing is a lot of drug use is co-occurring, or they are self-medicating because of their mental illness with drugs. And we're seeing a lot of that happen right now. And that's why it's really important that we're all on this together as a Department of Health board, and which is what I really appreciate about what Katie and her team's doing. So, in most addicts, as you can see, changing low point of attitude, it got them to seek treatment in the first place. Right now, what we're seeing through our, and John might even be able to talk about it, we're not really seeing a lot of people want or have to go through treatment because they're not being mandated or the court isn't making them go. And that's why we're seeing a lot, I believe, in the law enforcement world or in our world that we see why people are not getting the help is because they're not having to get help. So go ahead. So simple possession laws need to come back. That's what obviously we're looking for the legislature to bring back. There are some ways that the Blake decision that we can change that would make possession of illegal drugs holding people more accountable for. It takes a legislation to change that. And we also believe that with the data that we're compiling, not just the Sheriff's Office or HIDA, but when even the Department of Health, and when you're looking at even the EMS collecting all the data, you can see a reason why we need to really bring this under control, because it really definitely is affecting our youth. So go ahead. And obviously, Proprietary is the fight. We're the only one that does drug investigations, which that's why I get to have these meetings with other chiefs of police within Thurston County and try to convince them to be more involved in drug task force and being part of the solution. Obviously, we've extended all our efforts in working with federal agencies to really work this out together, because it does affect us, because if we don't affect the large cartel organizations bringing these drugs into us with our federal partners, we're not going to be able to stop the local use. And so we're really trying to build that team effort, and that's what HIDA helps us do as well. So, great. And there you go. We do speaking engagements as much as we can. We are talking about what opiates are like and how addictive they are. It's for a person who used to run a meth lab team, and when we saw why we became a HIDA county in the first place was back in 1999, when we were the first HIDA county in the state of Washington, because we recognized that the use of methamphetamine was a problem that was affecting our youth and our community. And now what we're seeing is that they've switched over to opiates, which is a really weird thing, because using opiates, not everybody imagines using a needle to inject a substance in their arms. I know we talk about smoking it, but in a pill form, you take it in a pill form, how it's absorbed in your system. But we are still seeing a lot of youth use injection, which is the most popular way of using heroin and fentanyl at the same time. So, I just wanted to speed through that. I know you hear a lot about it, but if you have any questions, please feel free to reach out to us, and we'll get the Narcotics Task Force to be able to help you out. But Johnny, did you? Come on. This is my cleanup.
Okay. All right.
Yeah, I don't have any slides, and I'll just try to be brief, because I think my comments really build on what the sheriff was talking about. And I just wanted to talk about kind of what's evolving in the legal system, particularly criminal justice system, to really focus in on the issue that has been brought up today, and that's fentanyl. But really, we're still seeing a significant issue with all substance use disorders, right? Fentanyl and beyond. And I'm going to talk about it in kind of three categories. The first is the essentially just the use and possession category, which, as you all know now, has been largely taken out of the criminal justice system through the Blake decision. And so we focused a lot of energy now on what I would call the street level response. The LEAD program that we have in Thurston County now is really running very well. We're approaching a year now and getting ready to have a celebration in terms of how successful that program has evolved and how quickly it has evolved. But that's a street level intervention program. That's a good example of how we're addressing that. And then there's other behavioral health kind of response systems that are developing. The legislature's made it clear that their intention is to try to create what I call a fourth first responder system, focused primarily on mental health and behavioral health, outside of physical health, police, and fire. And Thurston County is actually one of the places where we've started to really think about LEAD and that system together and starting to think about how that coordinates. I feel like we're a little ahead of the curve there. But that's really focused on, again, that user possession level. That's really not a criminal justice issue now the way it had been in the past. The second category is the folks who are committing other crimes, but there's a nexus to a substance use issue going on, substance use disorder or substance abuse. And by nexus, I mean it's things like committing property crimes in order to obtain money to then purchase drugs to feed their own use needs, their use habits. And so we're seeing crimes that I think everybody recognizes: burglaries, shoplifting, lots of shoplifting, vehicle prowls, all of those things where people can acquire things of value that they can essentially sell, trade, or whatever to get drugs. That's a place where we've really got to start to focus efforts, because what happened as a result of the pandemic, when the courts shut down, our inability to process those cases basically stopped because they were not priority cases in terms of violence, right? And so those are the cases that have in large part built up that I talk about when I talk about the backlog that's there. Lots of those property-related crimes that have at its root a substance use disorder. Our strategy to tackle that is still very treatment focused, right? So we have now pretrial diversion programs set up through pretrial services, kind of ready when we're able to start moving cases that way. We still have our therapeutic courts kind of ready and waiting. So my expectation is, as we start to ramp back up again, now that the court system has opened up, we've started doing some trials again, things are starting to move, we'll start digging into that backlog, and then we'll start seeing a lot more therapeutic referrals in that classification of case. And that's really got to be a focal point for us. The third category that I just want to mention actually just piggybacks on what the sheriff was talking about, and that is the traffickers. And I was glad when he put in his slide he used the word greed, because that's really important for the public to understand. When we're talking about drug traffickers, I'm not talking about user dealers, people who are dealing in order to make enough money to support their own habit. I'm talking about people who are selling large amounts of controlled substances for profit to basically feed their own greed. That's really now the focus of the enforcement, right? That's where we're really going to go after an enforcement standpoint, a punishment standpoint, if you will. And I continue to have a deputy prosecutor that's assigned to TNT to work with them. She also is now taking on most or all of those trafficking cases that are coming in. And I'll just also mention, I didn't want to give it its own category, but it's kind of a corollary, if you will. Unfortunately, we are now also seeing more referrals in the recent past for controlled substance homicide than I've seen a long time in my career. Controlled substance homicide is a special kind of crime that deals with people who sell or deliver a drug to another person, and then that person uses that substance and it results in their death. It could be overdose, it could be some other contributor in the substance itself, whatever it is. And it's almost like a strict product liability crime. If you sell something to somebody illegally, that's this illegal substance, you take on the risk that there is something in that, or that the person misuses it to their, to their detriment. And we have a few referrals now that have come in that we've not seen that kind of crime much in the past, but with this lethality of fentanyl, that's also increasing. We're taking those cases very seriously, and that's more of a very case-specific analysis, because you got to really look at the circumstances of what's going on to try to really find what the right outcome is for a case like that, what justice really is in a case like that. So those are my remarks that follow up on that and kind of what's happening in the criminal justice system, and I'm happy to answer questions.
Commissioner Mejia.
I don't have questions.
Commissioner Edwards?
No, just a bump deal that the laws have been relaxed to the point that it's killing our kids.
Thank you. I appreciate the opportunity.
Thank you very much.
Can I just say something about the presentation and just,
Yes, ma'am.
I want to thank everyone. I mean, I learned a whole lot about, for example, I did the Narcan training, but I didn't know it would take 5 times for a fentanyl overdose. I thought with one, it was one and done. So just hearing that sometimes it takes up to 5 is it just dawns on you of how serious the overdose is. I appreciate emergency services breaking it down with the data and the sheriff just how it's affecting law enforcement as well as the prosecutor, how it's affecting our criminal justice system. I think we missed the coroner here today because, but thank you again for all of this. Very informative.
Okay, thank you, Katie. Anything to close us out before we move on?
Nope, that's it. I just wanted to say thank you for letting us present today.
All right, appreciate the guests. Okay, Commissioner Edwards will be joining us virtually here just in a moment, and we'll continue on. We wanted to respect the time of our elected officials. We've got now the opportunity for the public to address the Board of Health. We do have some folks signed up, and I'll call for anyone that didn't sign up. The Board of Health welcomes comments from the public. There are certain guidelines. When you're called, introduce yourself, including the area of the county in which you reside. Address the board, not audience or staff. Silence your cell phones. Speakers are limited to 4 minutes to address the board. You cannot donate any of that time to another speaker. No comments that are lewd, offensive, inflammatory, hateful, defamatory, discriminatory in nature. Please be respectful. No outbursts of any kind. Commercial comments such as promotion of a for-profit business. No remarks about pending land use permits or similar matters that could come before the board on appeal. No electioneering comments, and any written materials may be considered public record and could be subject to public release upon request pursuant to the Public Records Act. So I've got Johanna first, Terry Ballard on deck, and then we'll call for other. Go ahead, Ken.
Sir, an additional perspective, please refrain from making any electioneering comments today.
I didn't throw that in, but thank you.
Thank you, Johanna, East Olympia off the Rainier Road. I'm here as an individual farmer today. On April 5th, I sent all of you an email in regards to the Department of Health proposed rule change related to keeping of animals. 2 things I want to point out quickly. One is that it could be interpreted by just me, a dumb farmer, as going so far as saying that in certain areas, I have to pick up the waste material from my cattle on a daily basis. The second thing, and this is why I sent it to you, and I was hoping that you'd consider it, is that the rule change puts the onus of enforcement on your county health officer without any funding for you. Thank you. Have a good day.
Thank you. Next is Terry Ballard.
Good afternoon, Commissioners. My name is Terry Ballard. I'm a 35-year veteran, and I live in Tanglewild. I listened to this, and I'm on track as a service officer for the veterans. We have veterans that need help, okay? And they come to us for help, and we put them in drug programs, homeless programs, all that the vet has to offer. Well, they don't have that for the homeless. 74% of the homeless have a drug addiction. 4% are mental health. That's 18% on the point-in-time report. Okay, there's about 850 homeless, and this is the data that they come to for having an honest homeless person come up to them when they're asking questions. Okay, so there's a lot more out there. We talk about needle use, needle exchange. Why? What are we doing there? Okay. Are we trying to get rid of one disease for another overdose? Okay. And we talk about accountability, marketing, use, death rates, arrests. I was really concerned about the arrests there. Okay. The use possession is out the door. Okay. We don't do that. Why? My question is why? Who is preventing us from creating laws at our level to do this? Why? Okay. I was addicted at one time to Percocet, okay, because of my injuries occurred while in Iraq. I was an addict, but I knew enough by getting with people that I had this addiction and I got rid of it. They gave me an alternate drug. What are we doing with the homeless? Do we have the social programs like mental health? Are we spending the programs on mental health? What are we doing? I'm totally aware on this. I'm totally online. I'm not here to blame. I'm just here to say, what are we actually doing? Are we just giving statistics all the time and carrying on? Okay. Out of 34% of the ages of 18 to 34 still live with their breadwinner parents. We're in a society where they're transitioning into homelessness, they're transitioning into drug use because they live at home and they have no other responsibilities. And that's another problem. So what are we going to do? And that's what I'm not hearing. I'm not hearing the programs that the 13 people out of the social services department, of 13 people in a social services department, that sounds really a lot less, okay? And then we're giving our home funds for somebody else that doesn't have what we have in the health and social service department. We're giving them money to do those jobs. Why? Okay, are they doing them properly, or are they giving a hand up versus a hand out to retain the homelessness, to retain the drug use, to retain these people? Okay, we need to transition these people somehow. And I've heard from Keith Swank. Okay, he's a 30-year law enforcement officer in Seattle. He says that the way to get rid of them is to put them through the jail system and the court system. If that's what it takes, why aren't we doing it? Well, I heard the prosecuting attorney tell me that use and possession are out the door. I still can't believe that. Okay, thank you.
Thanks, sir. Anyone else in the boardroom who'd like to provide public testimony who may not have signed up? Nope. Okay. Check the Zoom. I don't see, I don't know Laura Warner's. Okay. Anyone on the Zoom, just unmute yourself if you are here to provide public testimony to the Board of Health. No. Okay. Very good. Then let's go to next department item, which is DCP Division Director introduction. And, oh, that's, yes, okay, now I know. Hello, Ms. Warner. Kurt, I'm going to pass this baton to you.
Sure. Thank you, Commissioner. Kurt Harden, again, Interim Director of Public Health and Social Services. I'm here today to introduce to the Board of Health Dr. Laura Warner. She started in April, I want to say April, as our new DCP Division Director. Dr. Warner is the Division Director of Disease Control and Prevention at Thurston County Public Health and Social Services as of April 11th. She comes to Washington by the way of Colorado, where she served as Deputy Director of Operations at San Juan Basin Public Health in Durango. Much of her public health work in Colorado centered around community behavioral health with a special focus on suicide prevention. Prior to her work in public health, Dr. Warner served as a primary care physician with Kaiser Permanente in a suburb of Denver. She attended medical school at Rush University in Chicago and completed internal medicine residency and geriatric medicine fellowship at the University of Colorado. And she's earned a Master of Public Health from Colorado School of Public Health. So with that, I would like to introduce Dr. Warner and ask her to unmute and say a few words.
Hi, wonderful to meet you, commissioners. I look forward to doing so in person at some point when the time arises. Very happy to be here in Washington. I am I've chosen Washington since I have family in the area. So getting used to things here and happy to entertain any questions that you have.
Okay, your audio is kind of difficult to understand. Very echoey, like you're speaking into a tin can.
Maybe your microphone may be malfunctioning, but welcome aboard. Looking forward to working with you.
Well, thank
There we
you.
go.
Try a different microphone. Is that any better?
Way better.
Way better.
Kind of summarize what you said before. We'd love to hear it.
Okay, I'm so sorry about that. Okay, so I was just saying that it's wonderful to meet you commissioners, and I look forward to doing that in person when I get a chance. And also happy to be here in Washington. I have family in the area, so that's what really brought me here. And just looking forward to working with the group. So thanks so much.
Commissioner Mejia, anything?
No, welcome, Dr. Werner. Happy to have you on board. I know this position is very important to our community, so very excited.
Commissioner Edwards, anything?
No, I look forward to working with the doctor when time prevents and we get a little farther down the road. Thank you. Welcome aboard.
Thanks.
Very good. Yep, echo those comments. Appreciate you being here. And look, I'll have to take a trip over to Lily Road here in the near future and visit. Very good. Let's go to our Thurston County Medical Reserve Corps action, or item, sorry, volunteers in action. And we've got Daphne. Welcome.
Hello, Commissioners. My name is Daphne Devlin. I am the Emergency Preparedness and Response Coordinator at Thurston County Public Health, and I'm also the Thurston County Medical Reserve Corps Unit Leader.
I'm sorry, do you mind pulling the microphone just?
Thank you. Again, thank you for this time. I'm here to present our annual year in review for Thurston County MRC. I believe that in your packet you have our annual review. I'm just going to review some of that in our presentation, and then we also have some members of our MRC who will present their experiences. Next slide. I think this might be the wrong slide, but that's okay. Thurston County MRC. So we were established in 2003. Our unit was one of the first units formed in Washington State after the 9/11 attacks. President Bush then made our, sorry, this is the wrong presentation, but that's okay. Anyways, our membership has 152 active members. Yes, it is. I had sent an updated one, but that's okay. Let me just regroup for 2 seconds. We have 152 active members in Thurston County MRC, with 92 members onboarded in 2021. Many of those were healthcare providers who wanted to volunteer during the COVID-19 response. Our current membership has 70% medical professionals and 30% non-medical volunteers. I was going to talk a little bit about our membership process. We have a vast application process which was expedited during the COVID-19 pandemic to allow for more volunteers to be on the ground and serving our community. We have a brief orientation that we walk through with all of our volunteers. Sorry, this is not the right presentation, so I wasn't going to prepare to speak on this. I did want to speak on our community partnerships. We rely on Yeah, sorry about that. I don't even know where I'm at with this. I'll just go back to the start. Thurston County MRC was started in 2003 under the director Sherry McDonald and the health officer Dr. Diana Yu, and it was one of the first MRC units formed in Washington State after the call to serve after the 9/11 disaster. Since then, there have been many people and partners who have supported and maintained the readiness of this volunteer unit. All of these efforts have put us in a position we are today with a ready, trained group of medical volunteers and a variety of other professionals who are ready to serve the community in the event of a public health emergency. And these volunteers have responded to that call to respond during the COVID-19 pandemic. I'll go over some numbers shortly, but they have had a huge impact during the COVID-19 response. I'll go over our 2021 year in review. Again, we're not using the presentation, but that's okay. In 2021, you'll see that our MRC unit volunteered a total of 4,910 hours. That represents an economic value to the community of $313,000. You'll see in the report also that in 2020, the total volunteer hours was 2,414, and in 2019, it was only 944. So we had a huge increase in the amount of volunteer hours contributed to our community during the COVID-19 pandemic. Initially, our volunteers were activated in March of 2020 to assist with case investigation, contact tracing, and testing efforts. And then in January of 2021, we started with vaccination efforts, partnering with Providence Medical Group with the initial vaccine rollout, having our MRC members help with administering the vaccinations and also running the clinics, from traffic to charting. All of those important roles were filled by MRC, partially by MRC. So again, our total hours for 2021 were 4,910 volunteer hours, and of those hours, 4,475 hours were contributed directly to the COVID-19 response. So that leaves only about 435 hours that were training and other community events. We have supported the COVID response, like I said, with contact tracing, case investigation in 2020. And then in 2021, we focused mainly on vaccination and testing efforts. Some of our breakdown of our non-COVID response hours include training, our annual events such as our back-to-school immunization clinics, where we provide no-cost vaccinations to children under the age of 18. Those are school-required vaccinations, so we host those with our partners in the local school districts. Last year in 2021, we held 4 childhood immunization clinics where 170 immunizations were administered. These events are also a training for our Medical Reserve Corps. It's preparation for point of dispensing or pod operations, which we obviously have seen in place over the course of the pandemic with our mass vaccination events. Basically, our MRC are running a clinic from top to bottom with registration, immunization lookup, screening, flow monitoring, and then obviously vaccinations as well. So this was put into actual practice during the pandemic with our mass vaccination events, where our MRC were able to use that training that they had. Some other non-COVID response events that MRC participated in 2021 include community events such as the Washington State Senior Games. We held a first aid triage tent there, and also at the St. Martin's University Relay and Remembrance event. Those are training opportunities, again, for our MRC volunteers in the case of a disaster where they would be deployed to potentially set up a triage station. We also partner with the Nisqually tribe throughout the COVID-19 pandemic. We deployed out to the Nisqually tribe to assist with their vaccination and testing efforts throughout 2020 and 2021. And we also deployed out to assist with their flu vaccination clinics. They had one in October of 2021, and the Thurston County MRC assisted with administering 135 vaccinations. Some of our other events for MRC include planning and our robust leadership team. Our leadership team meets 4 times a year, and it includes a 7-member team, and we have 3 of our members here tonight who will be speaking on their experiences. We meet with the Thurston County Health Officer to help plan activities and trainings for the year to better prepare our volunteers for any kind of surge capacity needs. I also want to speak on some of our community partners. Community collaboration and partnerships are essential to emergency preparedness and response, so that MRC can provide support to our healthcare system and the activities needed. Some of our community partners are Thurston County Emergency Management, the Nisqually Indian Tribe, Providence Medical Group, Providence St. Peter's Hospital, Washington State DOH, CMAR Community Health, and local public schools systems. So I think that covers everything that I wanted to present on. Unfortunately, my presentation did not make it through here. I do have 3 members of our MRC leadership team. I have Dr. Britt Smith. He was our 2021 leadership team chair. Lucy Kegley is our current MRC leadership chair, and Ann Monahan is our vice chair. So I'll hand it over to Britt. Thank you.
Hi. Thank you, Commissioners, for once again recognizing the MRC. We are a community-based group. I'm Dr. Britt Smith. I've been a family physician in the Olympia area for the last 30 years. I also grew up in this town. I'm a North Thurston High School graduate. Coming back to my town and having the opportunity to serve with the MRC has been part of my giving back to the community that gave to me when I first arrived. Dr. Diana Yu started this organization in 2003. This came down actually from President Bush when he asked for volunteers for across America to defend America, make sure that we were safe. The fear after 9/11 is that that was not going to be the only event and that every community in America should be ready. MRC was our answer to that in this community through the Health Department and Emergency Services. And the advantage and the benefit to this community is all these people are vetted before the events occur. They are trained before the events occur, and that allows us to immediately respond when we have something bad happen, such as COVID-19. And starting in March of 2020, we were deploying people. She gave you numbers, 2,000 one year, 4,000 this past year. That's a lot of hours for volunteers to put in this community. And to be trained prior to the need allows us people to immediately jump into a slot and take possession of the desire and the needs. So that included first our contact tracing and investigation. We got to train down in Vancouver when they had the measles outbreak, and also doing paper training here at the clinic. Then when the need occurred, when we started having incursion of virus, we were able to call people, call families, tell them, hey, it's time to stay home. Please don't go out. Please don't infect anybody else. When the then we got the testing ability. So we had community setups. We went to nursing homes. We went to the prison to test people. That takes a lot of man hours, and it has to be somebody who's trained to do that. And these were medical personnel, but then somebody has to do the paperwork. Well, those are non-medical people. And then we had the miraculous warp speed development of a vaccine. That was the best thing that could have happened to all the communities, and I believe it truly saved lives and prevented morbidity, not just mortality, but morbidity. People who don't get really, really sick don't end up in a hospital, and they don't have long COVID, which unfortunately we're seeing way too many cases of that. We started giving vaccines in December, actually, of 2020. And then, of course, 2021 is when we had the mass vaccinations. We went from being able to administer one vaccine every 15 minutes per person to doing 12 to 16 per person, which allowed us to have the mass vaccinations at the Thurston County Fairgrounds and SPSCC, where we were administering 1,200 vaccines every single day. But that's not the whole story. We also went out to the community. We went to high schools. We went to community centers. We went to the Olympia and Lacey senior centers to give vaccines. That's a lot of different places, a lot of coordination by people like Daphne to put the volunteers at the location when they're needed with the supplies that they need. And I think that that is a vital resource for this community, and I hope that you continue to support us as you have. Do you guys have any questions for me?
I don't have any questions, just a comment. I went to many of the COVID, I volunteered for many of the clinics, and I saw many of, the volunteers there. And I just want to say on behalf of the community, thank you so much, because you came in when this community needed the most, and it really appreciative of everything you did, of how you were able to step up in a moment's notice and, provide these services, right? Our medical community was completely overwhelmed, and you went that extra mile right? And it shows here in the numbers how many hours you volunteered, and thank you so much, on behalf of the community, really.
So we have some other people who would like to, from our MRC board as well.
Come on up, and then after everybody's done, we'll go to Commissioner Edwards. Go ahead, ma'am.
Thank you.
You're welcome.
So my name is Lucy Kegley. I've been a registered nurse for 36 years. I've lived in Thurston County here for 19 years. I'm native Washingtonian, so.
Can you pull the mic down to your mouth?
Sure.
There you go.
Thany you. Okay. Did you get the?
Yeah.
Okay, great, thanks. I was asked to share a little bit about my personal experience with the MRC. So I joined the MRC during the pandemic in 2020. I was feeling isolated and powerless just like the rest of us, and I wanted to do something to help. And so the MRC has been a great way for me to use my skills to help out in this pandemic. So I have given vaccinations at those mass clinics where you roll in with your car, roll down the window, and giving a shot through the window. I had never given a shot through the window before, a new experience. So I've done those. I've done the testing, which is the same thing. And those go fast. By the time you're done the nasal swab, turn around, do the paperwork, there's another car right there. Things were well organized, they were moving, and we were really able, through the MRC and also the people partnering with us, the United Way and some others that were doing some support positions, we were able to really service a lot of the county. And that was exciting. I've also participated in some of the back-to-school immunization clinics. During the pandemic, a lot of kids got behind on their shots. And so being able to help out in those back-to-school immunization clinics really helped get the kids ready to go to school safely. And that's a big part of what the MRC does on a regular basis, is these back-to-school immunization clinics. It has been an honor to work with the MRC. They're the great group of people. Like Britt said, we're prepared. So we train and we prepare so that whenever there's a disaster or emergency, we are ready to go. And we're ready to add just the extra manpower, the extra boost to the county to address these situations. So I think the MRC is a really valuable asset to this county. All right, thank you.
Thank you.
Can you see me over the podium?
Yeah, you're good. Just keep on bringing it down. Good.
My name's Ann Monahan, and I am a registered nurse. I retired in 2018 after 44 years of nursing. And I worked at St. Peter for 15 years, and then for the clinics, Providence clinics, for the last 5. So I felt so sidelined when the pandemic began, because I was watching my colleagues that I had just recently left in my practice, and was so concerned for them and their health. I began my time with the MRC in April of 2019, and at that point, we were I was doing the follow-up with people that had had positive COVID tests, and that was done over the phone. And I really enjoyed that because I really connected with the people that were very, very frightened because they had been diagnosed with being positive for COVID. And I did that initially, and then when the vaccines rolled out, we couldn't wait to get going. And so, like with Britt, we started at St. Peter I think my first clinic was December 17th, so at the very beginning. And it was so good for me to be able to contribute and to be able to take care of the healthcare colleagues. And then we rolled into the 55 and older, and I thought, once I get through that group, because that's my group, the 65 and older, and I would probably not continue, but I wanted to do it because it was such a good thing for our community. And I feel so honored and so pleased that we had, or I had the opportunity to work with the Medical Reserve Corps because, like Lucy said, I was able to use my talent, my skills, my experience to help people through a really difficult time. And I know we're not all the way there, but we have made a difference in a lot of lives. And I'm very grateful for that opportunity. And thank you very much for having us and recognizing us.
Thank you, Ann. All right. Commissioner Edwards, anything for the crew?
Yes, but I'm going to keep it short because Commissioner Mejia really did cover just about everything I was going to say, other than I just want to give my heartfelt thanks to all those folks that participated and continue to participate, obviously. But you folks are unsung heroes, and there's just no two ways about it. And at the same time, I recognize everything you folks did. I know our own folks at the health department, they just about burned out on this whole thing too. So kudos to all of you. I can't give you enough accolades. It's just thank you is about all I can say. I wish I could buy you all a drink or take you on a vacation, but probably won't work. Thanks.
All right. Great. Well, I just echo my colleagues' comments, and I'm just wondering if this incredible uptick in hours, I'm sure people that were already involved probably worked harder, and I'm sure a lot of people who came out of the woodwork who stepped up, and I'm wondering if they were so excited by their experience that they want to keep staying involved in Medical Reserve Corps. And it'd be really cool to see the number of hours just increase kind of on an ongoing basis because people had a good experience. I know some people probably just wanted to step up for the pandemic, and that we certainly appreciate that. But I don't know, just a thought. It'd be really neat to see, people stay involved because they felt like they were making a difference. And I want to thank all of you. I remember speaking about, I didn't know anything about the Medical Reserve Corps before I became a commissioner in 2019. And I remember the first time I got an annual report, 2019, I was just awed by the people that were stepping up and what they were doing. So, and that was before I even knew anything about a pandemic. So this is just really cool. Okay, thank you so much. Well, we've got one more business item and then we'll get to our reports. And I know we're running a little late, so let's try to keep things succinct. I'm gonna go to Art Starry for this item on the sanitary code ordinance setting a public hearing. Art, what do we got going?
Good afternoon. Again, I'm Art Starry, the Environmental Health Director for Thurston County Public Health and Social Services. And I'm here today to ask you to set a public hearing on June 14th at 4:30. I didn't put that in the AIS. To consider an ordinance to amend Article 1 of the Sanitary Code. And you're probably wondering, well, what are the amendments going to do? And the point is that we've learned something from the pandemic, and since we've been talking about that there are elements in our Article 1, which is kind of our administrative rules that tell us how we conduct hearings and how we go about assessing penalties and things that could be changed to be better for everybody who might be involved in one of these situations where there's a compliance action or a hearing or something that takes place. And what we're want to do is to incorporate some changes that allow us to do more things electronically or virtually, over the phone or using Zoom or something, as opposed to being required to have in-person meetings. And I know Commissioner Edwards earlier was worried that we might be that there could be something that would require us to do things electronically. And this doesn't, but it does give people the option, basically the hearings officer the option, to be able to do more things electronically if the situation warrants. And I could go through some of the things really quickly. It allows us to, if you were to adopt this ordinance, after the public hearing, it allows us to do more things electronically. Certain types of applications and documents can be submitted electronically. It allows us to use email, providing that we can document the receipt has taken place of hearing notices and things like that. It confirms that the health officer, who basically is the person who conducts the hearings when there's an administrative action that's taking place, such as an appeal or something, it allows them to do those sorts of things electronically at their discretion as warranted by the situation. And so it may be that all the parties agree that a virtual hearing would be best. It might be that they agree that they want to have the hearing in person, and that's what the hearing officer gets to decide. But this gives them that option. Because right now, once the pandemic emergency declaration of the Board of Health expires, then we don't have that option. We'd have to have everything in person, and sometimes it just doesn't make sense. It also provides some additional latitude for the administrative hearings to take place when there are permit violations in a food service establishment. Right now, that isn't clearly authorized in the code, but we found that that's really an effective way to be able to address problems rather than to go to closure or to do penalties. Having a hearing and a discussion to try to figure out how to resolve problems is an effective way to do that. And so this gives us clear authority to do that when it's warranted. It also provides some additional discretion in the case of civil penalties and notices for the hearing officer to actually give people more time and to better set the conditions for when payments are due or when compliance actions are necessary to better meet the need for the particular situation. Right now, those are specified in code, and the hearing officer doesn't have very much discretion. So we want to give them more discretion in that case. And there's some other housekeeping and things that have taken place where we recognize there's better word choices, or maybe we made a mistake in a previous edition, and we're going to fix those while we're at it. So in a nutshell, that's it. We're again asking you to set a hearing that would take place as part of your Board of Health meeting on June 14th. And if you go ahead and authorize this hearing, we've got the hearing notice prepared, and we'll work with the clerk of the board to get it published. And we also have a copy of the ordinance with the edits and things in it in bill format that we'll post as soon as possible, most likely tomorrow, if you authorize this hearing. So without any further comments, that's it. If you have any questions, I'll do my best to answer them. And I also want to thank Jane Futterman for doing all the hard work and drafting this stuff with whatever assistance we could provide.
Okay, Commissioner Mejia.
I just have a request from the clerk of the board, since the county manager is not here, that we do not place another public hearing for the Board of County Commissioners, not for the Board of Health that day. That way we're able to get to this matter, hopefully, on time.
Commissioner Edwards.
I'm prepared to make a motion, sir.
Art, should the motion add the time and place since it's not already in here?
It would probably be best to say that at 4:30 in room 280, and also it'll be a hybrid hearing, so Zoom would also be allowed, but probably listing the time and place would be best. Sorry, I didn't include that.
And the idea would be that the Board of Health would start at 3:30 and we'd presumably get done in an hour, and we'd have the public hearing at 4:30 or shortly thereafter.
That's the way it is intended, but it's if you believe it would be better to have it later, that's fine too. I don't anticipate this will be a long hearing. I hope it won't be.
All right, Commissioner Edwards, did you catch that for an amended motion?
Yes, I did, but being I'm remote, do you suppose I could ask my seatmate to make that motion for me?
That'd be fine, I think.
Yes, sir.
Mejia, go ahead.
I move to set a public hearing on June 14th, 2022 at 4:30 p.m. in Building 1, Room 280, to consider an ordinance to amending Article 1 of the Sanitary Code for Thurston County.
Second.
Motion has been made and seconded to set a public hearing on June 14th, 2022 at 4:30 in Building 1, Room 280 of the Thurston County Courthouse. And is there any further discussion on that motion?
No, sir.
No, sir.
Call for the vote.
Commissioner Mejia?
Aye.
Commissioner Edwards?
Aye.
Commissioner Menzer?
Aye, the motion carries. We'll have that public hearing in June. Thank you, Art.
Thank you very much.
Board of Health members, health-related activities and accomplishments, if any. Commissioner Mejia.
I'm trying to think. Just COVID, and then of course just the issue with the pop-ups and the permitting for that.
Commissioner Edwards.
Actually, my report is identical, Commissioner.
Okay, and I stumbled into a very long and extended meeting about pop-ups myself recently. So I learned a lot of things I didn't know before. So we're going to be addressing that issue. And on the sake of time, let's go directly to our health officer's report. Dr. Abdulmalik, welcome.
Good afternoon, commissioners and Board of Health. I will do my best to make this succinct. So I did want to first relay a few answers to the questions that we talked about this morning. I think, so first off, the question about what the underlying reason may be for why Omicron is less virulent, meaning causing less severe disease than prior variants. There are a couple of factors. It's not well understood, but at its most, some of the more clear explanations include that at this point, large amounts of our population have some form of immunity or protection, whether through vaccination and or prior infection. So that's likely playing a role. Additionally, when we look at the tissues that are primarily involved and damaged during SARS-CoV-2 infection, Omicron disproportionately actually affects the upper airways rather than the lower airways. And some of the disease of the lung tissue and lower airways disease plays a significant role in severe illness and death when we're thinking about folks being on ventilators or having difficulties with oxygenation. So once again, this is a virus that does mutate and change, and different variants do have different properties. And we're on a cycle where things are changing very quickly. So I anticipate that we will have much more information and and a more granular understanding going forward. But these are kind of two of the major components to that have been shared. In terms of hospitalizations or incidents of severe illness compared to number of cases, I was looking at state data, national data. It's really hard to get the data to line up so that you're looking at the same data set for the same point in time. So what I did want to do is I wanted to refer folks just as a gestalt back to our the report that we share with each of you each week. So looking at the week ending on 5/1, the 7-day total. So once again, there is a little bit of a lag on data reporting because these are verified results based on date of specimen collection. We had 4,125 cases reported during the 7-day range from 4/13 to 4/19. That same week, we reported 8 hospitalizations in that 7-day period. This trend has continued on to this week in terms of we reported 4,238 cases over the most recent 1-week period and had 9 hospitalizations in the most recent week recorded. So so that gives a sense of where we're at in terms of severity. However, our transmission rates are going up. I encourage folks to think about their own risk factors for severe disease, and if they may be in a situation where if they became positive for COVID-19, if they're in a situation where they might spread it to someone else who might have different risk factors for severe disease. So I'm encouraging caution moving forward. I did want to step back and talk about a few other non-COVID related activities. So over this past month, our disease control and prevention team has followed up on 75 confirmed and suspect cases of notifiable conditions. And this includes Campylobacter, chlamydia, gonorrhea, chronic hepatitis C, as well as highly antibiotic resistant organisms, among others. We did receive in Washington State notification about avian influenza. So we've been seeing over the past several months avian influenza, which is an influenza A virus, H5N1, which has been affecting both wild birds as well as domestic flocks across the country. Just this past week, this influenza virus was identified in a backyard flock in Washington State. Thankfully, this has low transmission potential for humans. There has been just one recorded case in the US that was reported at the end of April, and no known human-to-human spread has occurred. So this is something that we're watching closely. In terms, so we've sent out information to healthcare providers last week in alignment with CDC and BoH guidance. So we anticipate partnering with Department of Health as well as our healthcare providers to work on the human side of this illness should it arise. Department of Fish and Wildlife are taking point on the wild birds, and WSDA in alignment with USDA is taking point on domestic flocks. So just one message that I wanted to share with the public is that folks should really avoid unprotected exposure to sick or dead birds, bird feces, litter, or any sort of materials contaminated by birds with suspected or confirmed viral infections. In general, if you see a bird that's sick or dead, leave it alone. And that folks who have been exposed to H5N1 should monitor for signs and symptoms of influenza, and they should monitor for 10 days. And so as we hear cases and reports of folks who may have been exposed, we will be helping folks during that observation period. The other piece is just a reminder that if folks are dealing with sick or dead birds, to wear full PPE, as well as any healthcare providers that are working with suspect cases. And this is the same droplet airborne contact precautions that we're all really well practiced with COVID. That we are also, so in terms of general influenza, our influenza activity for Washington State is low. At this point in time, there have been 13 laboratory confirmed influenza deaths for the season to date, and 5 influenza-like illness outbreaks in long-term care facilities. We do continue to monitor the situation. In terms of some of the environmental health work that we've been doing, we had a few situations arise over the past month, including the identification of an open, uncovered septic system for which action was taken, both to prevent injury with an emergency health order, as well as support for the property owners. There was also an incidence of sewage surfacing in the front yard of another home, and there was another situation where a septic tank was being drained into a ditch near another property. So our staff worked with the property owners essentially to correct these problems and ensure that the health of the public was protected. I did want to take just a minute at the end of my report to thank everyone who presented at this meeting. I am so proud to be working with all of you. This includes our folks who presented on mental health, on fentanyl and the impacts in our county, as well as our MRC, and of course our Intrepid EH team. And with that concludes my report. Thank you so much, commissioners. I'm happy to answer any questions you may have.
None from Commissioner Mejia. Commissioner Edwards, anything?
Commissioner Edwards, no. Good report. Thank you.
Very good. Me neither. Thank you for that follow-up. Let's go to Kurt Harden. And Kurt, if you weren't going to touch on it, could you include an update on where we are with our 1152 stuff?
Sure. I'll lead with that then, Commissioners. The 1152 is expansion of the Public Health Board and the Board of Public Health. And so that the Board of County Commissioners went ahead and passed the ordinance increasing the Board of Health. And so what it does is it follows the legislation that was recently passed by Washington State, and it's going to expand the Board of Health starting July 1st. And so what we're doing is going to do outreach to fill the to recruit to fill those additional positions on the Board of Health. So that is going to be moving forward over the next several months. But the new Board of Health, or the increased number of positions on the Board of Health, it takes effect on July 1st.
Next several weeks, right, Kurt? Not months.
Yeah, that's, well, I guess it is my perception that the time is flying. Well, I guess we're already into May. You're right, Commissioner. We are moving fast.
And when will that recruitment process, like people are asking me, and when can I tell them that they can fill out their application or whatever that's going to look like?
Yeah, we're meeting with the county manager here in the next week or two, and to develop the application process, and so that we can reach out. And there's definite categories of public health positions that have been identified, and so we'll be reaching out to those groups as well.
Okay, Commissioner, you had your hand up.
Yes, I did, because Sarah will kill me if I don't mention it. But I will be doing a coffee with a commissioner on the expansion of the Board of Health. It's going to be live, and it's going to be at the Sandstone Cafe in Tenino on May 19th from 2:30 p.m. to 3:30 p.m. So if you would like to hear more about this, I will be joined by our county manager as well as Gretchen Thaler. And yes.
Okay.
I had to throw that plug in.
All right, go ahead, Kurt.
Okay, so more information to follow on May 19th then. The next one I'd like to touch on real quick is the Washington State Public Health Association Secretary's Award was given to Thurston County Public Health and Social Services team. Traditionally, this award, and it's a 2021 award, traditionally it's awarded to an individual for outstanding contribution to improving the health of Washingtonians. However, in 2021, it's being awarded to all the workers in local health jurisdictions across Washington State to recognize their COVID response. And the next one I want to talk to is on this coming Monday, we are going to have, and the public health officer is going to host a healthcare summit that will be at 1 o'clock on Monday, May 16th. And we've already sent out flyers and information and outreach, and this was discussed in detail this morning during the agenda setting. But I just want to remind everyone who's tuning in that they should be looking for that if they're a healthcare provider, and that will be taking place via Zoom. The next one I want to talk about real quick is our nurse family partnership nurses saw more than 180 families over the month of April. This is really critical because as we have opened up from COVID and we're starting to get back to a normal process and operations, we are starting to increase our non-COVID services and reemphasize our non-COVID services. We held a drug take-back day events in both Tenino and Tumwater recently, and in Tumwater we had the Tumwater Chief of Police and Tumwater Council members attended that. And I'm bringing that up because that is really critical for taking back the drug take back day, based especially on the opioid briefing we heard earlier in our meeting. I want to talk a little bit about our private sector testing laboratory in Olympia has closed recently. So what that's done is many of their customers are now coming to Thurston County Public Health to have their water samples tested for coliform and fecal coliform bacteria and or nitrates. So the Environmental Health Division has put together a plan on how to process and service these additional requests that are coming in. Also, the next one I want to talk real quick, as in noted in the Board of County Commissioner meeting and agenda setting this morning, TST staff briefed the TST community grant proposals that took place, and the review team scored those proposals and brought them forward to the Board of County Commissioners. And with that, subject to your questions, that concludes my report.
Nothing for Commissioner Mejia. Commissioner Edwards, anything for Kurt?
Nope, I think I'm good. Thank you very much.
Very good. I am as well. And with that, we are adjourned for this May Board of Health meeting. Thank you.
Thank you, commissioners.